Welcome back. Thank you so much for staying with Monday Special. The hashtag is Monday Special KE. We're talking about maternal and child deaths and what we can do to increase safe deliveries across the country. But first, let's take a look at some of the numbers before we introduce you to my panelists and delve into the discussion. Okay, we'll introduce our panelists first before we take a look at those numbers. We have Sharon Mureithi, who is sitting across from me. Sharon will be telling us a little bit about her own story. And then we have Professor Guyo Jaldesa, who is a gynecologist, and he'll be giving us some of the medical issues around the matter of safe deliveries. And then we have Wanjiru, who is the founder of Still a Mom, an organization. She'll tell us a little bit more about it, but that really deals with talking to and encouraging mothers who have lost their children. So she'll tell us a little bit more about that in just a moment. I don't know if we have those numbers right now. Yeah, I hear we have them. So let's bring them up on the screen and kind of highlight some of what we want to discuss in our discussion. Then we have maternal and child deaths in Kenya, the direct causes of maternal deaths. That's a list, hemorrhaging at 41%, infections, and the list goes all the way to other reasons at 14%. And then we have the top 5 leading counties in Kenya. And we have Mandera at number 1, Wajir, Nairobi there is at number 3, Nakuru and Kakamega. And I think this is just an indication of the number of mothers that lose their lives each year, maternal deaths. And this information is all thanks to UNFPA, the United Nations Population Fund, who provided us with some of that information. Thank you, all of you, for joining us on Monday Special tonight. I think before we hear from Sharon and Wanjiru, maybe, Dr. could you give us an idea? This seems to be a large concern, and we know the issues around maternal deaths in Kenya is among the worst, I think, in the world. As a medic, tell us about the situation, why we're seeing a lot of maternal deaths, children dying as well during and after delivery.
Okay, I think I need to give you a global perspective in that maternal death refers to the death of a woman while pregnant or within 6 weeks after the end of the pregnancy for causes which are not accidental or incidental. Mm-hmm. That cause must be pregnancy related for us to consider it as maternal death. Mm-hmm. And globally, it is estimated that 350,000 women per 100,000 births die, which may be translated into every 5 minutes, 3 women are dying somewhere in the world, which may be translated into some kind of a jumbo jet carrying 240 passengers, crashing every 6 hourly.
That's huge.
It is huge. Mm. A jumbo jet is crashing every 6 hourly and killing all the passengers on board. And all the passengers are young, healthy women in their reproductive age. Mm-hmm. And at the same time, for every 5 minutes that we are saying, about 70 babies are lost, which is a significant amount of loss to humanity. Mm-hmm. And especially when you consider that these women are people who are healthy. Pregnancy is not a disease, and they're dying not of disease. And as one Mohamed Fathala, a former president of FIGO, which is the Federation of International Obstetrics and Gynecology, said, women are dying not because of diseases that we cannot treat. It's because the societies have not made their decision that their lives are worth saving.
Wow. And so that basically boils down to things like facilities, enhancing facilities, and creating an environment that's safe for them to deliver.
So if you look at what are the causes of this problem, it's very simple, basic thing. The availability of basic essential supplies and equipment in health facilities, provider competency and skills, effective referral system. We were told Mandera is one of the places with the highest maternal mortality. But if you see a person in Mandera, somewhere in Banisa, somewhere in Ramo, getting complicated and to be taken to Mandera District Hospital, what do they go through to reach there? And the issue of, in medical terms, we talked of 3 delay model. What causes the delay in women getting treatment? So, like, for example, in many places in Africa, there's something called delay in seeking decision. And why is that people are delaying in seeking decision? It's because of the value people put in women's lives. That a woman cannot decide on her own that I'm unwell and I need to visit the hospital. She has to seek permission from somebody, and somebody has to consider whether that is something worth going for.
Yeah.
Especially if she's to rely on her mother-in-law.
Yeah, to make that decision
to
for
make
her.
that decision for her.
Doctor, I do want to get to Wanjiru and Sharon very shortly so that they can share some of their stories.
Basically,
yeah, you've talked.
Then after that,
yeah,
even if after a long struggle the woman decides that now they need to go to the hospital, what do they take for her to reach the health facility from home, from somewhere in a village in Mandera to reach a district hospital in Mandera? Let me stop you there. I know at some point, you know, on Monday Special, we're going to be delving into the policy issues because it's crucial, and I think that's a huge reason why we're seeing all of these problems. Is there any other medical reason, maybe if there's a trend now, and again, you can explain that for us, that there's so many of these cases still happening, aside from facilities, maybe if these are women who can access good facilities, have prenatal, antenatal care, but this still happens. Could you give us an overview as to why this would still happen? Let's take a look at a perfect scenario where someone is healthy, or so they thought, go to a good facility, are able to deliver, these complications still happen. What are the main reasons, and is this a rising trend that we're seeing in Kenya? Okay, very briefly before I hear from Let me put it this way. Number one, the 5 major killers of mothers in this country and most places in the world is hemorrhage, especially mothers who have given birth, and because of lack of basic medical supplies to prevent the mothers from bleeding, women bleed and die. It is the largest cause globally, constituting globally about 25% of maternal deaths. Number 2 is infection, sepsis, especially people getting infected after delivery. And because people don't know how to diagnose that thing, they die of it. High blood pressure, especially when it's not controlled. And because of we don't have machine to check the blood pressure, you just find a woman convulsing, fitting in the health facility. Or sometimes they don't even check. Okay. Things like abortion. All right. And safe abortion. Okay. Because globally people said, in other countries where abortion has been legalized, women don't die as a result of abortion. Women die as a result of abortion in countries like Kenya and Africa where abortion is restricted. Okay, the final one. Yeah, the final one is obstructed labor, where women are having prolonged and obstructed labor, and that is the cause of the fistula that people talk about. Right. Okay, doctor, thank you for that. We'll come back and ask a few other questions. Wanjiru, tell us a little bit about your story. And then what led to you founding Still a Mom?
Well, it's not really a long story. It's just that in 2013, in November, I was 20 weeks pregnant. That's 5 months. And then we lost our baby to an infection called listeria, as the doctor has said. And then the next year, in 2014, we lost an early pregnancy at 7 weeks. And so that left me wondering, why is it that I've never heard of the word miscarriage until now, you know? And so I went and did a bit of research, tried to look at, are there any support systems existing? And I found there were none. And because after my first loss, I left my job. And so I decided now, with all this research, I needed to do something. And I shared it on Facebook and on my blog, and the feedback was overwhelming. Okay. So now Still a Mom is currently a year old. We launched last year in October. And we have reached over 200 women through support groups, both physical groups that meet and even WhatsApp groups that are run by counselors. So we are supporting that woman, but also our second job is also to create a lot of awareness. All right. Yeah.
First of all, I applaud you so much for that. It's an amazing initiative, and you're helping so many women. I know one of them is Sharon, and she'll share her story very shortly. Doctor, I'll come to you in a minute. Take us a little bit back to, you talked about your first pregnancy, you lost your first child because of an infection. Yeah. And I know tonight we're trying to shed light on some of these issues to advise women in terms of, you know, safe delivery and safe pregnancies. Was there something that you could have, some information that maybe you didn't have that caused that, or what happened exactly?
Actually, yes, there's something that could have been done, because what happened is I had listeria and I didn't know what it was, and the doctors did not know that I had it until we lost the baby. The thing is, you know, you feel unwell and you go to the nearest hospital because probably that's where you're covered, you know, and then probably this is also something we women do. So today you go to Avenue, tomorrow you go to another hospital, the next day, and you know, you don't have quite one place that has your records as such. And so what happened is they all were telling me, you have an infection, your blood pressure, not your blood pressure, your white blood cells are very, very high, but we can't quite point out. So it's actually the doctor who finally saw me after my loss who figured out and actually did a blood test. So it's something that, because all the meds I was being put on until now were not quite touching that infection.
That's a concern.
Yeah, that's a concern.
That's a concern.
Yeah.
I also want to bring in Sharon, doctor, before you comment. Again, thank you for taking time to come here. Tell us a little bit about what happened with you in your journey and how you lost your child.
Okay. My pregnancy was easy, no complications at all. Towards the end, I couldn't feel her move. So I did about, I think, a day and a half, and there was no movement. So I went to hospital, and I saw the doctor, and the doctor checked, and the doctor said, "You're fine." So I said, "No, I'm not fine. I've not felt the baby moving." So then the doctor goes back and says, "For how long hasn't she moved?" So I start counting back, and it was more than a day. So then they said we can admit and either monitor or take you for a CS, because I was going for cesarean because I'd had a previous cesarean. That was the only reason they were taking me for that cesarean, I think.
Okay.
So on checking, so I checked into hospital because I was sure she had not moved. So they opted to have the cesarean option. So I went into theater that night. I think it was about 10 p.m. and it was fine. It was a half cesarean, so I was awake. So I could see you don't really see, but you hear what's happening. So everything went well until the baby was removed. So you feel like you feel a vacuum. So once I felt her come out, I didn't feel her cry. I didn't hear her cry. So of course I'm asking, is she crying? Is she crying? And they say, no, she didn't cry. So they moved the baby to a place where you can see. And she didn't cry for about 2 minutes. So they resuscitated and she cried the 3rd minute. So then I was told she's crying, she's fine. Then immediately I was told she will have some problems, but we'll look into it, and so let's finish with you. So they finished with me, and I was wheeled out with my baby. So immediately we were wheeled out. I met my husband, my mother-in-law were there. So they saw the baby 2-3 minutes, and then the baby was taken to the ICU. Not the ICU immediately. They took the baby to monitor. So they put her on oxygen immediately. So she wasn't breathing as she should have been breathing. So she was on oxygen for that night and the next day. So the next day I walked down to where the nursery was, and I saw the baby. The baby was fine. She was, I think, 2.2 kgs at birth. So she was a big baby, not so big, but she was okay. So yeah, she had the oxygen mask, and I was told, a few days she'll peak. So when I saw the pediatrician said that the lungs are always the last organ to develop, and she came in a month early. So her lungs were not developed. But we'll support her, we'll put her on oxygen, and she should peak. So I went back to my room, and we were there, and I think I was with my mom. Yes, I was with my mom. So then they called and said, you have to come down to the nursery. So as I went down to the nursery, as luck would have it, my whole family appeared. My dad came, my brother came, my husband came. So now we're all there in the nursery, and we're standing there, and the doctor says we have to transfer immediately. So transfer why, to where, for what? He's just saying we need to transfer this baby. So of course there we're asking questions, they're not being answered. So he's saying, call this hospital, you need this much to move into this private hospital, you need this much to move into that private hospital, or we can take you to this public hospital that has a good facility. So there were not many options at the time. It's in the evening. You can't raise 500,000 in the evening to get into some hospitals. So the decision was made to move us to one of the public hospitals in the private wing. So I couldn't go with my baby. So my child went with her father. I was left in the hospital because I couldn't be discharged immediately. So my child went with her father in an ambulance, and he took her to hospital and filled in a paper and left her there, because you can't, it's an ICU now, so you can't stay there, nothing. So then he came back. Next day I was discharged. We went to the hospital. Now when we got to the hospital is when we were told that yes, her lungs are not developed as to where they should be, so she'll be put on a machine to help her breathe for a few days, and we see if she peaks. She peaked. We were in the ICU for 10 days. in those 10 days, every other child in the ICU passed away, except my baby. So, and there were many. There were 6, 7 beds in that ICU. So, everyone lost a child. We got out of the ICU in 10 days, and then now we moved her to the private wing nursery. She was in the private wing nursery for a month, because we spent 5 weeks in hospital. No, for less than a month, because in total it was 5 weeks. So she was in the nursery for some time. In this other nursery, she developed pneumonia, which I only knew about when we were being discharged, and I saw the sheet. Because to me, she was sick, so I'm asking the doctor, is she okay? She's on this medication, she's on antibiotics. We're not being told what exactly it is. So anyway, she came out of it, she came out of the pneumonia. So then we went home. So we went home, of course, after being in a hospital for that long. So I remember, yeah, we went home, me, my husband, my mother-in-law. We got home, you know. We prayed, put the baby home, because you know, we're glad we reached home, so that's
finally.
it. We're at home. So we were at home for a week. And she was a normal baby in this 1 week. I mean, we had a sleepless night in between this week where she kept us awake. Normal baby.
Yeah.
So she passed away on a Wednesday. We got home on a Wednesday. She passed away the next Wednesday. The Tuesday before, she had a bit of a cold. That was the night that she didn't sleep well and she had a cold. So I told my husband that we have to go to hospital. We were not sure. The doctor said anything small, go back. So we went to hospital. We took her to her pediatrician, the one who'd been seeing her all along. The doctor checked and she confirmed that the baby's fine. She'd lost a bit of weight, which was normal. So baby's fine, added vitamins. She didn't add anything else, and I think she changed the formula or something small like that, and we went home. So we went home and we were fine, continued with her medication. On Wednesday, she woke up fine. Normal day. At lunchtime, the father came home for lunch, so he took her and I slept. So then he put her in her bed and told me she's asleep, so when she wakes up, watch the baby. So when the baby, she cried as usual, so she woke up, so I picked her up, I put her on my bed. So as I'm preparing her formula, I checked she was not wet. So as I'm preparing her formula, because first you give formula and then breastfeed because of her weight issues. So as I'm mixing her formula, as I turn, the baby is not breathing. She's gasping for air. So with no first aid, I start breathing into her mouth. Then I realized this breathing into the mouth is not helping. So I start screaming. So my mother-in-law lives near, she lives around. So I don't know who heard and someone screamed, and my mother-in-law came, and we were just looking at the baby and we don't know what to do. So again, as God would have it, I live close by with my in-law, so my father-in-law removes the car, my husband gets home, so we pick our baby and we run. So we're in the car, we're going, we don't know where we're going, the baby is not breathing. Now the baby she's movement is reducing, you're seeing she's getting darker, her lips are getting darker. But to us, she's breathing. So we got to the closest hospital, because now from where we live, it's quite a distance to the next private hospital. We knew she needs oxygen. So we're trying to get to the closest private hospital, but it's a bit far. So we decided to stop at a clinic and get oxygen. Again, as God would have it, my auntie is a director at one of the clinics. So we stop and she confirms, yes, there's oxygen running. So we run in, we give the doctor the baby. She's put on oxygen. So at this point, I leave the room and I walk outside. So then my auntie calls me and she tells me, yeah, there's oxygen, but... So we're trying to call now. We're looking for an ambulance to take us to now that at the hospital. So as we're trying to call, we're calling here and there, looking for an ambulance. This doctor says that don't call an ambulance. So what do you mean don't call an ambulance? We're not going to put her in the car and go. So no, don't call an ambulance. We can't move her like this. So what he's saying is she's passed away. So we keep saying, no, we're calling the ambulance. He says, if you call the ambulance, it'll be expensive. Don't call the ambulance. So my auntie calls me and she says, Kendi, the heartbeat is very low. So I ask, is there a heartbeat? So she tells me there's one, but it's very faint. So what are you saying? You know? So at this point, our baby had passed away. So then when my husband went back into the room, you could see that the baby has passed away. So then he asked, is the baby alive? And well, from outside,
you could, yeah.
Yeah.
Wow, okay. I mean, first of all, for you to just come and share that, you know, thank you. It's obviously not something that is easy to talk about, and we just felt it's right to give you the space to do that. Can I ask if, you know, you've mentioned a few things in terms of, you know, we were given vitamins and this and that. Do you think if things were handled differently, there would have been some different kind of outcome? Is there some kind of caution or advice that you have for other women when it comes to and making sure that this is safe delivery and that babies are then well looked after delivery? Do you know what I mean? Do you feel like more could have been done in retrospect?
Definitely more could have been done, because when after I researched, for me to go into theater a month before the time of delivery, I should have been given a steroid jab. Dr. Correct me if I'm wrong. Am I?
No, you're not.
So she should have been given a steroid jab?
Yes.
Okay.
I missed that steroid jab.
Did you, and they didn't tell you, did you?
I didn't know at that point that
right.
I needed to have a steroid jab, but supposedly I should have gotten that jab.
Yeah.
Because my understanding is it opens the lungs.
Okay.
It helps the lungs develop.
Okay.
So that could have been done differently.
Yeah.
With my doctor, I have full confidence in her. She saw us through much more, so I think for her, she really couldn't.
Couldn't have done more. Before we hear from the doctor, and I know we need to begin winding up, any sort of advice, Sharon, or just looking back in hindsight, is there something that you would want to say to other women expectant? Is there something that you think people need to know? And are there concerns that you have regarding the fact that there's a lot of deliveries that are not successful, either mothers are dying or the babies are dying? Is there some kind of advice that you would want to say to other women who could be watching this right now?
Well, for women who are pregnant, of course, we're hoping it won't go the way it went for me and they won't lose their babies. But my main concern is in counseling after you lose this child, because being in that facility, in that ICU for all those days, I saw all those ladies lose their children. First of all, the way they are told that their child has passed away is based on the mood of the nurse. Wow. So some got it really harsh, some so, as in it's a pathetic situation.
Yeah.
And then just leaving that hospital, because you know when you leave that hospital, public hospitals give you, they give you clinics before you deliver free of charge. They give you delivery free of charge, right? After you have your baby, you go for clinic free of charge. Now, what happens to this lady who walks out without a baby? You walk out and you go home. They should offer some counseling.
Okay, thank you for that. Wandera, I'll have you comment in just a few moments. We've really almost run out of time. Doctor, she mentioned something about the steroid jab. Now, as generic as this sounds, are there any do's and don'ts, so to speak, for expectant women to ensure that they reach full term in a way that they're healthy? Is there something that can be done? Is there something that women and their partners, for instance, need to know? If you could just give us a very brief summary. I know it's very broad and every pregnancy is different, so we can't exactly hone in, but is there something that people need to be very aware of as they're carrying their baby to full term?
Okay, I think the basic principle is that every pregnancy is special.
Yeah, sure.
That is the basic thing. And that women are expected to attend antenatal clinic care under the care of a qualified, trained provider. And that these visits, according to WHO, is supposed to be a minimum of 4, but it is need-based. You can have it as many times as possible, depending on one's need. During these visits, what every responsible clinician does is to make sure that the mothers know the danger signs. What will make you go to the hospital at that time, even if it's night? How prepared are you in going to these facilities? So that it's your responsibility to make a choice of which hospital you want to go to for your baby. In case you have any problem, where do I go? The case of her, about the issue of steroids, we may not understand it in full context. Yes, the issue of steroid is supposed to be given for any premature delivery. But did they have time? Because we need to give some 24 hours for the steroids to work. At worst, some 12 hours. By the time they came to the health facility, under the care of whoever it was, did they have that luxury of waiting for the 12 hours, especially when considering that there's no fit of movement for the last probably.
Okay, so like you're saying, it's different.
For
every
different
situation
people.
is different. Yeah.
So if it's something planned,
Yeah.
yes, we give it. Certain times we say it's an emergency, we have to deliver the baby and we have to go for it.
Okay.
So if you go for it, the only thing is, depending on where you are, the pediatrician who's going to receive the baby should be able to understand that, yes, we are having this, and therefore we must prepare in this way to receive that premature baby.
All right. Again, one or two more questions because I have to hear from Wanjiru as she winds up. Is there an issue of neglect when it comes to some of these facilities?
To be honest, yes, neglect is there. The facilities are different, and that's why the medical practitioners and dentist board, the nursing council are all there to regulate the practice of people. And there are cases where people had actually failed. But there are also sometimes when institutional failure, systemic failure is there.
Okay.
So the issue of the policy that we talked about, who's supposed to practice? And where are you supposed to practice?
Okay.
Are the kind of things that will cause neglect. But if you go to the issue of counseling that you mentioned, sorry.
Yeah. I'll come to her to talk a little bit about the counseling as she winds up. Yeah.
I know most of our public health institutions lack counseling.
They lack
counseling.
Yeah. Okay.
I know major private hospitals in Nairobi, without any contradiction, have a good counselor and women are looked after in case such a thing had happened.
All right. Finally, doctor, so you've already talked about the visits and everything that's important. Any final words as we hear from Wanjiru finally in terms of awareness when it comes to pregnancy, when it comes to safe deliveries? Any final words, any awareness that people need to be, anything that people need to be aware of, rather, very briefly?
Okay, usually the thing that tells a woman that the baby is doing well is the movement of the baby. And every woman, when you find that your baby is not moving, because you know the behavior of more or less the movement of your baby, if there's a change in that, it's better for you to go and seek the opinion of healthcare provider. Let them examine you, observe, do an ultrasound and tell you everything is okay, than you sitting and waiting for calamity, because it's quite traumatic.
Okay. All right. Okay. I think we'll end it there. I know that we could discuss this at length. Finally, Wanjiru, as you wind up, what have you seen? You've done a lot of support groups, you know, and helped a lot of women. What are your concerns around where facilities need to be in terms of, like what Sharon said, providing a lot of these opportunities for people to be able to go for counseling, and your own parting words to women who have experienced the loss of a child?
To begin with, on where facilities should come in is, one, breaking the news. And maybe it's something the medical fraternity needs to be trained on. So you will hear many of the women I work with say that she was told, you know, Madam hapa hakuna heartbeat, in a very reckless or careless manner. Or she was just told, go to the reception and fill in a DNC form. And she does not know what that is. So there's how we handle that woman who has come in. And I understand that the medical fraternity is very overwhelmed. That is true. And sometimes you're the 10th patient to walk in. And sometimes she may not, your doctor may not be quite keen. But I think that is something we need to work on. But now to challenge or to talk to the women is this. I'd repeat exactly what the doctor has said. Please take charge of your pregnancy. I have worked with so many first-time moms who've lost babies, and I even see it on Facebook. People say, I'm feeling this and this, what should I do? Don't ask your peers. If you begin to spot, and you probably know that that is not a very good thing, rush to the hospital. You'd rather be told, go home, everything is fine, as opposed to asking your peers on WhatsApp groups.
Actually,
or
the
Facebook.
dangerous thing is the issue of Dr. Google.
Yes.
Yeah.
Where
He's
people are Googling for everything.
Yeah.
Yes.
Instead of referring to their provider,
They're Googling everything.
you are Googling.
Yeah.
All right.
And
So
as
call
you're
your
Googling,
doctor if you have
it
to.
doesn't give
just
you
to make,
Or
just to be sure.
visit. Go there and visit.
We're completely winding up. Like I said, we're going to be having a series of these discussions on Monday Special very soon. I thank all of you for coming, Sharon and Wanjiru, for being courageous, for coming and sharing your stories. The healing process, how is that going for you, Sharon? How are you doing now?
I hope, I don't know, I think I'm doing okay.
Okay.
Yeah, we're doing good.
Yeah. All right. In yourself?
I'm doing all right.
Doing
I
okay.
think it really, really helps to work with other women and to see them come in when they are broken, and by the time they leave, they're doing better.
They're doing well. Again, I thank you too so much, and for forming such a group. I applaud you, and thank you for doing that for so many people around the country. Doctor, thank you.
Okay.
You want to say one more thing? You'll keep us here for a while. Okay.
No, I think it is the
very, very briefly before you bring up some tweets and feedback.
It is the responsibility of healthcare provider, especially as an obstetrician. My duty is to make sure that every wanted child is delivered healthy.
Okay. Okay.
Every child that she conceives must be delivered in a healthy way, and she remains healthy.
Okay.
That is our duty.
Yeah.
And we try to do that.
Okay. Yeah. Right. Thank you. Thank you once again. The hashtag is Monday Special K. We'll be right back with your feedback before we wind up on the show. Stay with us.